Hello everyone, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to another session. This is Dr. Sana. Today we are going to discuss about behavioral sexual abnormality. Behavioral sexual abnormality refers to the patterns of sexual thoughts, urges, or actions that are unusual and cause harm, distress, or involve lack of consent. It's a term often used in psychology to describe when sexual behavior goes beyond personal preferences and becomes problematic or unhealthy. In simple definition, the behavioral sexual abnormality is atypical sexual behavior that is harmful, non-consensual, or cause significant distress or impairment to other person. Now let's look into the key criteria or what makes it abnormal in clinical sense. People have different types of sexual interest or different patterns of sexual interest, but what you should note that not every unusual sexual interest is abnormal. It is usually considered a problem when at least one of the following or one of the points which I'm going to describe is present. One is lack of consent. When it involves or the sexual activity involves or sexual process involves others without their permission, includes coercion, force, or exploitation. Second one is harm or risk. If the sexual activity causes physical or emotional harm to self or others. Number three is distress or loss of control. If the person feels unable to control the behavior or that person's unusual sexual behavior interferes with the daily life, relationships, or work, then it is considered as abnormal. Let's look into some examples for your understanding. Let's look into some examples in clinical context. Some behaviors studied under this category fall within paraphilic disorders when they meet the harmful criteria. For example, exhibitionism, that is exposing oneself to unsuspecting people. Second one is voyeurism, watching others without their consent. Number three is sexual sadism, inflicting harm without consent. Number four is pedophilic behavior involving minors. So let's look into important distinctions. Normal variation, that is consensual, safe, mutual, agreed behaviors, even if it is unusual, not considered as abnormal. Now, behavioral sexual abnormality, when it is non-consensual, harmful, or uncontrollable, it is considered as a psychological or behavioral issue. Now let's look into the causes of behavioral sexual abnormality. It can vary to people. One is psychological factors, trauma or conditioning or childhood experiences, etc. Number two is difference in brain and reward system patterns. Number three is early exposure or learned behavior. Number four is impulse control difficulties. Now let's look into why it matters. Such behavior can harm others and lead to legal consequences, affect mental health and relationship. So it matters. And now let's look into the next point. Can it be treated? Yes, it can be treated with professional help like therapy, especially cognitive behavioral therapy, behavior management strategies, and sometimes medications. Let's look into the bottom line. Behavioral sexual abnormality is not being different. It is about whether a behavior is non consensual, harmful, or out of control. So that's the end of today's topic. We will come back with another topic in the next video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.